I thought a monster had gotten into me.
That monster, relentless tremors. For decades, Rita Sevart tried to hide her shaking. On today's All Things Brain Health, we share the procedure that gave Rita her hands and her independence back. Good morning, I'm Alexis Del Cid. Welcome to All Things Brain Health. Essential tremors are some of the most common movement disorders in the world. They impact around 10 million people in the U.S. alone. And it can make simple things like drinking your morning cup of coffee or even signing your name borderline impossible. Rita lived with those tremors for nearly 60 years before finally finding a treatment that worked. Here's reporter Jessica Lovell.
I was 10 years old. I was walking in a park at a field trip at school and was walking back to the bus, and all of a sudden my hand just started jiggling.
That was nearly 6 decades ago, and Rita Sevart remembers it like it was yesterday.
I thought a monster had gotten into me.
Years would pass, school, marriage, even children came, before Rita, around the age of 35, would decide to face the symptoms she had tried so hard to hide.
Definitely the shaky hands, but also just anxiety. I would be afraid to go anywhere where I needed to hold a cup or be out in front of people.
Doctors would eventually diagnose Rita with what's called essential tremor, a condition that affects the nervous system and causes shaking, usually of the hands. You can see here just how bad it had gotten over the years. Rita researched options and chose the University of Kansas Health System and neurosurgeon Dr. Jennifer Chang.
Dr. Chang is the best. They told me she was a perfectionist, and I agree, and I think that just calms you down when you know somebody is going to make sure they get it absolutely right.
Dr. Chang used focused ultrasound, a minimally invasive procedure that targets and destroys a specific area of the brain that causes tremor in the hand.
I had my first hand done in 2021, right during the pandemic.
The procedure reduced Rita's tremor by 95%, and recent FDA approval cleared the way for her other hand.
I play piano. I'm sewing again.
Finally getting Rita back to the life she had long put off.
What a great story. And Rita joins us virtually from her home. Rita, how are you feeling this morning?
Just fine. I was weepy watching that.
I could see it in your eyes. What's it like watching your journey?
Sometimes it's hard to remember it because it was so traumatic. Every day was a struggle. So now life is much easier.
It's so great to see you playing the piano and doing the things you love. We're also joined by your neurosurgeon, Dr. Jennifer Chang, who's here on the set with us. Thank you for being here, Dr. Chang. And we welcome Dr. Rajesh Pahwa. Dr. Pahwa is the medical director of the Parkinson's Disease and Movement Disorder Center. Now, Dr. Pahwa, you didn't treat Rita, but you can sure help us understand what was happening because this is such a common movement disorder, so thank you for your time. I want to start with you, Rita, because you tried to hide those tremors. You were so self-conscious of them for years. What was that anxiety like every day, having to live with that?
I would try to hide, literally. Sometimes I would skip school if I knew I had to do something that was a solo thing or up in front of a class. And believe it or not, my grades didn't suffer because I was at a small school, and I think the teachers understood the stress I was going through.
Can't even imagine that, and to go through that as a child. You know, we saw your hands in the videos that you shared with us. How did your tremors alter your everyday life as you got older? What were the most simple tasks that gave you the most anxiety?
As you can see, eating.
Sure.
But also like computer work. I had to lean on my side to keep doing my computer work at work, and not so much signing checks, because you don't do that so much anymore. But still, there was always, if you sent a card to somebody, you want to write your name. And I look back at some of those handwritings, I can't believe it was me.
And to suffer with this for 60 years is such a long time. I want to talk about, with Dr. Chang, exactly what's happening in the brain when you have an essential tremor. Can you explain that to us in a non-medical way, how that works?
So actually, we still don't fully understand why people have essential tremor. We know that it can be, like, it can run in the family, so it can be genetic, but still we don't fully understand the mechanism of it. We think that it's a disease that can involve slow neurodegeneration, like progressive neurodegeneration, and disturbances in some of these circuits that help our movement. So there's different places in the brain, the cerebellum, thalamus, cortex, that are all, coordinate together for our movements. But it's thought that there can be maybe some abnormal cell or signaling there that causes the tremor.
You're able to target the part of the brain in the procedure that we're going to get deeper into that procedure, but how do you know, how did you figure out where the tremor is coming from, what part of the brain it's coming from?
We know from a long time that there's a small part of the thalamus that if we treat that part of the thalamus with our surgeries, that we can control the tremor. So that traditionally has been things like deep brain stimulation, which is another surgery that we use where we stimulate the brain there. And then there's focused ultrasound, where we actually create heating at one spot, at that part of the brain, and that's done to control the tremor.
People who aren't familiar with where the thalamus is, where in your head, in your brain, is the thalamus?
It's a larger structure that's near the midline of the brain on the right and left side. So there's kind of like two structures right near the middle of the brain.
Okay, and just
that's
kind of across.
Yes,
the
and
middle.
but then there's, with the thalamus is a very important structure that relays information between different parts of the brain. And there's one structure, which we call the ventro-intermediate nucleus, or VIM. That's the small part of the thalamus that is targeted for this surgery.
And Dr. Pawa, when it comes to these tremors, how is this different from other conditions like Parkinson's disease? Dr. Pawa, I think you might be muted on your end.
Sorry about that. I thought they were going to unmute me automatically. But the thing is, with Parkinson's disease, where the cells are dying, and because of the dying cells, there is less dopamine and multiple other chemicals that are present. So that's one thing that happens in Parkinson's disease. Because of that, there are very distinct symptoms that occur with Parkinson's. In addition to the tremor, there's slowness, there's stiffness, there is walking difficulty. Whereas in essential tremor, really you're looking at just tremor that is present. Having said that, there's also a different kind of tremor in Parkinson's disease and essential tremor. In Parkinson's disease, you have tremor, what we call at rest, when the body is just sitting and you have the tremor, and as soon as you start eating or drinking, the tremor gets better. Whereas in essential tremor, while you're sitting, you don't have a tremor. And when you start doing things like eating, drinking, writing, that's when the tremor comes on. And that's the big thing that affects people's life. So that is a big difference. In spite of that, about 10 to 15% of the essential tremor patients are often misdiagnosed as Parkinson's, and about 10% of the patients with Parkinson's are misdiagnosed as essential tremor. The other thing to remember is these are two distinct conditions. So there are some people who may actually have both Parkinson's and essential tremor. Fortunately, this is a small number, like 5% or so. But those are the challenges we can at times face to differentiate these conditions.
So Rita, you underwent focused ultrasound, and you saw some big improvements. So let's dive into what focused ultrasound looks like. Dr. Chang, what exactly is happening during the procedure?
So you kind of saw that, you see the pictorial, right? So there is a helmet, like a spherical helmet that we arrange around the patient's head. And then within that, there are over 1,000 sources of ultrasound energy. So those little like blue lines that you see there, that's the ultrasound energy that is being aimed into the brain and focused on that tiny spot in the thalamus. And when it does that, it causes heating. Okay. And so our goal is to heat that target in the thalamus. Again, the VIM was the name of the target, and basically create some permanent damage in that tiny spot in the brain. And that is done to control the tremors.
And during this procedure, you're operating things on the other side of a glass window, which is fascinating. So what are you doing during this procedure as far as how you're controlling things? So
we make prescriptions for each treatment. So when we're saying, okay, let's give some ultrasound energy into the brain, then I basically go into the computer and program that. Like, we're going to give this much power, this many seconds.
How do you know how much power?
Just from experience and from, the teaching. That's how we know. After we've done this procedure about 350 times, probably, or more at KU for the last 5 years, so since 2021. So we basically prescribe how much power is going to go into that sonication treatment, and then at the same time, we then monitor each treatment. So the treatments last from 10 seconds to sometimes 20 seconds. But as the treatment is going, the MRI runs, and it tells me the temperature information in the brain. So what I'm doing is I'm sitting there monitoring that temperature and making sure, and then making adjustments. We also go in and interact with the patient multiple times during the surgery because we want to see how the tremor is changing.
That was my next question for Rita. What do you remember about getting that treatment? What did it feel like?
I always tell everybody it was intense, but the thing about it is I remember all of it because I have told a lot of people about it and how it could help them. So I do remember a lot of it, and you are awake throughout all of it. It's just very noisy with the MRI machine, you tend to float. So you have this feeling of floating, and so you kind of keep your eyes closed so you feel like you might float away.
Is the floating feeling the brain's response to getting that stimuli? Do you hear that often?
Yeah, we do hear people describe, floating, spinning, like little dizzy, things like that. That's pretty frequent when we are doing this procedure.
It's so fascinating. So Dr. Pawa, how long has this option been available at the health system?
So it has been available since 2021 or so. So we have been doing it for over 5 years.
Okay.
Yes.
And Dr. Chang, you said you've done about 350 of these?
I think with myself and my two partners, starting in 2021, we've done, I think, about 350 or maybe more.
Dr. Pawa, how common is this procedure to treat essential tremors?
So one of the challenges with this procedure is not only you have to have the MRI machine, but you also need to have specialized software and hardware. So it's not something that any institution or any hospital out there having an MRI machine can do it. In addition, of course, you need skilled neurosurgeons. And in some places, it could be like a neuroradiologist also doing it. But you need someone who can actually also do this procedure. That's the limitation about how many centers can actually do it. When we joined in, we were like the 9th or the 10th center in the country to actually be able to do focused ultrasound. Of course, now the number of centers has gradually increased, and I don't know the exact number, but I would guess around 30 to 40 centers around the country are doing it now.
Dr. Pawa, can you tell us a little bit about the handwriting tests that you do before and after the focused ultrasound treatment?
Yeah, so that is very interesting because when we are evaluating patients with tremor, we don't have any specialized tests. One of the challenges, as you heard, which are the most common, is eating, drinking, and writing are some of them. Writing is something you can actually do it in the MRI suite or in an exam room or wherever you are. It's a simple test to see. And that also shows an improvement that occurs. And like you see here, the patient having a lot of difficulty writing, a lot of tremor in writing and drawing spirals. And in the end, you saw the first video where handwriting was normal. So that's one of the tests we use to actually see if the procedure is having improvement.
Rita, what's the first thing you remember doing outside the hospital after you had the focused ultrasound and things had improved?
I ate soup.
Ate soup, okay.
Because I had not been able to do that at all.
Sure.
And then I began typing with both hands.
How long did it take you before you could play the piano again?
I don't play very much, so it's still taking quite a while.
You
but
look pretty good.
can actually,
You look good to
I
me.
can actually do the mechanics of it.
That's just so nice. We already have some questions and some comments coming in from our viewers. So if you have a question or a comment that you'd like us to read out loud on the program, you can send it to us right now on YouTube or Facebook. The links are right there on your screen. Now, Rita, I want to go back to the part about you being awake during the procedure. You said you felt like you were floating. Afterwards, what did you feel like? Did you feel any vibrations or sensations once you were done with the procedure?
No, actually, I remember coming into the wake-up room, basically, even though I was already awake, and I just said I have to go to the restroom, and they said, okay. And they walked me to the restroom, and there wasn't any kind of dizziness or that bothered me. But it was just so quick and everything, and then I was able to leave really quick after that.
You had to have the treatment done a second time because some of your tremors returned. So how long after the first treatment did you have the second treatment?
I don't remember. It was about 9 months because I had to find Dr. Chang then. That's I started looking and I found out KU was doing it, and before they had not been doing it. And so I was probably one of the newer ones, or the beginning ones, for Dr. Chang to work on. So it's about 9 months.
How common is it, Dr. Pawa, that the tremors aren't completely eradicated after the first treatment?
Yeah, so it is actually not very common that people have to go back for the same side. Of course, we are not talking needing the procedure for the second side, which is an entire, but looking at the same side, it's not common at all. I would say it's about 5% of our patients might have to go in for a second procedure to help. One thing to remember is when Dr. Chang does the lesions, if you make them too big, then you have side effects and complications. And at times, making it too small, you may not get the benefit that you need. So from our standpoint, we would rather have a smaller lesion and someone having to go back a second time rather than going for a big lesion and risking more challenges for the patient.
Well, that makes sense, Dr. Chang, because you can always do more, but you can't undo.
Right. So that's the thing with this procedure. This procedure is very attractive to patients. It's minimally invasive. We don't make any incision. We don't drill in the bone. And it's like basically usually one and done. But at the same time, just as what Dr. Pawa was saying, is that it's irreversible. You know, the goal is to make that permanent small lesion by heating that tiny part of the brain, and we can't undo that.
Right.
So that's why there is also caution, as he said.
Better to be conservative.
Right.
So
right.
Dr. Pawa, when you look at the future, what do you see or what do you hope for in the future when it comes to essential tremor treatments?
So, as you said, essential tremor is one of the most common movement disorders. Fortunately, it does not reduce mortality. It's more the morbidity, difficulty doing tasks that is a challenge. And because of that, the research and coming up with new medications has been a challenge. Ideally, we would like to find some medications that help the tremor. That way we don't need to do surgery or such procedures. And hopefully we'll get there someday that a pill would take care of the tremors completely, that we don't have to, damage the brain, so to speak.
Damage the brain, but for the best possible reason to change Rita's life. And Rita, you had a really big support group. How did you find the support group that you're part of? And what is that group like?
Well, the Essential Tremor Foundation is based out of Kansas City, and I just found it by doing an internet search. And through them, we started the support group here in Wichita. And then also my family has been a great support group, but now it's also online. So if you can't find a support group to go to, you can just go online and do the Essential Tremor support group.
You never realize how many people are struggling through the same struggles until you find a group like that where you can give each other that kind of comfort. Want to get to some of the questions from our viewers. Jenny has a question. She wants to know, my mom's hands shake, she writes. How do you know if it's an essential tremor or something like Parkinson's disease? Dr. Chang?
So it's important to be evaluated. Some people are often treated initially with a primary care physician, where they say, okay, well, let's try, this medication that could be helpful for tremor. But it's often helpful to be referred to a neurologist. So if you have a neurologist, then they can evaluate the person clinically, look for other symptoms, like Dr. Pawa said. There could be other symptoms if you have Parkinson's disease, not just tremor. And then it'd be important to, of course, try the correct medication to treat the tremor.
Jeremy has a question, and I'll give this one to Dr. Pawa. What makes an essential tremor essential? Is that a certain type, or is there a non-essential tremor? Is that a more formal name for tremors in general? That's a good question. I was wondering why is it called essential?
Yeah, so it's an interesting story. This is from years and years. So this is not something that we have come up with essential tremor recently. So when we first had patients who had tremors, of course, there was no cause for the tremor. So it wasn't that, like we talked about, other conditions causing it. It was that the patient just had tremors without a known cause. So that's how the term essential tremor came. We also used to call it earlier on familial tremor, because about 50% or so of the patients have a family history. We at times used to call it senile tremor because it often is seen more in people as they are aging. But now we kind of use one term for all of that, which is essential tremor, which is we don't know what causes the tremor.
Rita, do tremors run in your family?
I thought they didn't, but since I've had tremors and told everybody in the family, my sisters now have developed it as they age. I found cousins that have it on both sides of the family. So
that's interesting.
Yes, definitely.
Marie has a question for you, Rita. Marie wants to know, before your treatment, was there anything that triggered the tremors? When would they be at their worst?
Anytime I was asked to do something in front of people, speak
the
in
anxiety
front
of
them,
that?
yes, because the anxiety is a major part of it.
Boy, talk about a vicious circle. Because the more you get anxious, the more you get those tremors. So I can, oh man. Was there anyone you were able to confide in when you were a child about these? Did you have anyone to talk to outside your immediate family?
My mom took me to a doctor, just a GP, and I would say he was a country doctor, and he didn't know what it was, and he just said I grew too fast, because in 1 year I grew like 7 inches, and so that's what he blamed it on. Only problem is it never stopped.
Right, and that's not much emotional comfort for you.
No.
Jacqueline wants to know, how many times can a patient keep getting these treatments? Is there a limit, Dr. Chang?
So first of all, when we do the procedure, and then let's say we want to do the other side, which is, someone has right hand tremor, so we're going to treat one side of the brain, and then they also want to treat the other side. There's a limit. There is a amount of time that passes before we can do the procedure over.
Got it.
So usually about 9 months between the two sides. And then repeating the procedure, kind of like what Rita described, was that she had the procedure. Initially, tremor went away, but then it kind of came back early. And that's the pattern that we sometimes see, probably 5% or less of patients. We see that. And then we can try to do it again if there seems to be a reasonable target to go after again. So when we do the second time, we actually have to choose a slightly different location to treat, because you can't reheat the same area. So you have to.
And you can see where
sometimes you can. If you have a good quality MRI, you can see the original lesion, and sometimes you can't see it very well. But you do have to change the target when you go again. So I would not say that I've seen people do it on people more than twice.
Right, because
for one side. Yeah.
Hasn't been necessary more than twice.
And or some people may not be a good candidate for doing it a second time. There are some physics with this procedure. In some people, the skull blocks most of the energy, the ultrasound energy that's coming towards the brain. It gets blocked by the skull. So some people either just are not qualified to be a candidate for the procedure, or we do it, but we fail to achieve the temperature that is needed to get a permanent treatment.
Jim has a question. Jim wants to know, this is a good question, is this a last resort procedure? What would be the next step for a patient if this wasn't an option or this didn't work? I'll ask Dr. Pawa that question.
Sure. So the thing is, there is, like Dr. Chang mentioned earlier, we have deep brain stimulation and we have focused ultrasound. We offer patients both, and both have their advantages and disadvantages. With deep brain stimulation, we have to put in a wire in the brain connected to a pacemaker, so it has a hardware that is implanted. And like I said, then the focused ultrasound that we just discussed what it is. So if someone has focused ultrasound and for whatever reason the procedure was not available, let's say the person has too thick a skull and they are not a candidate, then they can undergo deep brain stimulation. On the other hand, if they have had deep brain stimulation, they cannot get focused ultrasound because they have a hardware in the brain. So it really comes down to one of these two procedures as what we would say the final treatment option in our patients.
Okay. As we wrap up this discussion, I want to get today's takeaways. And Rita, I want to start with you. What do you want people watching this to take away from this conversation?
If you think you have essential tremors or your hands are shaking, you don't know what it is, get help, look it up. Don't give up your independence. I think that's a big thing. And just go right away, because there is wonderful people in the world like these doctors who can help you.
When you wake up in the mornings, do you still feel like you're dreaming, not having tremors anymore?
No, actually, I forget sometimes that I had tremors.
Oh, that's great.
Yeah, that's amazing.
Life is so good, you forget what it was when it was rough all those years.
Yes.
Is that video of you sewing? What are you making right now?
Yes. I'm still working on a quilt top for somebody. Actually, my daughter has to help me because she does the quilting. All I do is make the tops.
That's fun. And Dr. Pawa, what would you like our viewers to take away from this conversation?
Yes, so the first thing is, every patient with essential tremor does not have tremor that bad that it affects their daily life. A lot of people may have very little tremor, that they may only notice it under certain circumstances, like when they're anxious or scared or whatever it might be. For us to start considering such procedures, the tremor has to affect their activities. And the common ones are eating, drinking, writing, using the computer. So if it doesn't affect any of these activities, really, we don't have to go for something like a focused ultrasound or deep brain stimulation, because it does have its risks. And same thing, one side versus two sides. When you do two sides procedure, the risks are higher than one side, where in some patients with two sides, you can get some speech difficulties and balance difficulties. So yes, it is a very effective treatment, but it is not for patients just because they have essential tremor. So you have to make sure the diagnosis is correct. Two, it is affecting your life before you consider these procedures.
And Dr. Chang, how would you like to close out this discussion?
Yeah, I would just say that I would echo what both of our, what Rita and Dr. Pawa said, but I would just say that, seek help. Like, you don't have to live with that. So number one, perhaps medication will help your tremor, and then you'll not have to deal with that. And that would be excellent if that were the case. So, seek help, seek the primary care doctor, or seek a neurology referral, and, get on the right medication. And then, and again, just to echo what Dr. Pawa said, is if medication then fails to adequately control your tremor, then there are multiple different kinds of surgeries that can be considered.
There are options.
Yeah, there's options.
Thank you so much for taking the time to join us,
you.
Dr. Pawa. Thank you. And Rita, thank you for sharing your journey with us this morning. Coming up tomorrow, a stroke can happen at any age. Meet the young woman who's using her personal journey to spread awareness tomorrow at 8 a.m.